Hello, everyone. My name is Khalid. I'm an editorial fellow for the Journal of Immunotherapy and Precision Oncology. And I've got Dr. Srivastava with me today to talk about her study. Dr. Srivastava, you want to introduce yourself?
Sure, absolutely. I am a recent past fellow of MD Anderson Cancer Center. I was part of the head and neck surgery department, and that is where most of the study was actually conducted. And that is specifically the section of oral oncology and maxillofacial prosthodontics. So I am an oral oncologist and maxillofacial prosthodontist, and I am now affiliated with the University of Illinois at Chicago. A lot of what we do is, of course, do prosthetic rehabilitation for patients who are oncology patients, trauma patients, and kids with congenital defects. But as part of the oncology team, what we also do is see a lot of patients with treatment-related morbidities. So osteonecrosis tends to be one of them, and I know that's what we're talking about. And then a lot of radiation-associated morbidities, and we're seeing more and more of immunotherapy-related oral morbidities, and that's a large focus of my research currently.
Well, thank you for joining us today. And as you alluded to, we'll be talking about your study published in the Journal of Immunotherapy and Precision Oncology about medication-related osteonecrosis of the jaw in patients treated concurrently with antiresorptive and antiangiogenic agents. And this was a systematic review and meta-analysis. And I just wanted to start by asking you what prompted you to carry out the study.
Sure. So osteonecrosis is something that we still consider to be sort of an uncommon condition, but to be very honest, as it progresses, it can turn into being a very debilitating condition for patients who are affected by it. And what we're seeing now is from 2003, when the first cases of bisphosphonate-related osteonecrosis of the jaw were described, to our current landscape in 2021, chemotherapy has changed dramatically. We have breakthroughs in immunotherapy, like I said, and we have newer targeted therapy. And these agents are now being associated with osteonecrosis of the jaws. And these agents don't necessarily fall under the category of antiresorptive drugs that everybody has been aware of, like bisphosphonates and denosumab. So there are so many newer medications and agents that are being implicated in osteonecrosis. And as I was saying, osteonecrosis, as it progresses, it can cause substantial loss of dentoalveolar structure. It can result in more complex events like pain and trismus and extraoral fistula, oral antral communication, sometimes fracture of the jaw. And in rare events, it can be very life-threatening as well. So I think as a topic, what we see in the clinics and research, this is a very interesting topic to me.
Yeah, absolutely. Very important. What is the most important message from your study that you'd like to leave with our readers and our audience?
Sure. So this particular study is a part of a larger meta-analysis that we carried out. In this particular study, we were looking at what is the synergistic effect, so to speak, of antiangiogenic and antiresorptive drugs. And what we're seeing is a trend towards increased prevalence and risk of patients developing osteonecrosis of the jaw when they are on both these medications concurrently. And that happens quite a bit. There's more and more targeted therapies that are being used in conjunction with antiresorptive therapies. So within this meta-analysis, we saw that there is a lot of statistical heterogeneity in the studies that have been published out there, the studies that are out there, but it's all clearly showing a trend towards increased risk with, combination of drugs, essentially.
Okay, that's very good to know. Is there anything that you would recommend to clinicians to reduce the risk of the osteonecrosis of the jaw in these patients who may be taking these antiresorptive agents and antiangiogenic agents?
Yes, absolutely. So there is a lot of evidence out there on the benefits of implementing, a good pre-therapy oral evaluation and preventive treatment. So essentially developing a close coordination or collaboration between oral health professionals and patients' primary oncologist, I think becomes very important. I know a lot of centers already have protocols for antiresorptive drugs where patients, prior to starting bisphosphonates, will be seen by a dentist or a maxillofacial prosthodontist or an oral oncologist to get clearance, but essentially comprehensive oral examination, prophylactic care, and most importantly, patient counseling. I think these should be adopted by all oncology centers that are catering to this population. And not all, medical centers and hospitals, especially smaller centers, don't necessarily have integrated dental services. So there is a huge need for developing, care models where dental oral health professionals and oncologists just have better access to each other, when they're catering to this patient population.
Excellent. I think you briefly mentioned about trial heterogeneity as being one of the challenges I think that you face when conducting the study. What would you recommend for future steps in terms of studying the risk of osteonecrosis and jaw osteonecrosis in particular with these anti-angiogenic agents?
Yeah, so that's a great question because, osteonecrosis is something that we've been concerned with bisphosphonates and other antiresorptive drugs, and that just always becomes, part of the trial, no matter what trial is happening. That is a noted outcome. So first of all, I feel like all newer trials into targeted therapy, any other kind of cytotoxic chemotherapy, newer immunotherapy, osteonecrosis should become an outcome that is, carefully studied. Another part is most of the studies that are included in our meta-analysis, longer term follow-up studies are the ones that are kind of showing us more data into osteonecrosis. So there's definitely room for, or definitely a need for having, prospective cohort studies that look into osteonecrosis. And then essentially just understanding what is the confounding effect of multi-drug modalities or how other systemic comorbidities play a role into patients who are just taking antiangiogenic therapy and they develop osteonecrosis. So I guess there's a lot of future development that needs to be done in terms of just the study design and just incorporating osteonecrosis as an outcome that's studied.
Sounds like it, but hope that's something that gets paid attention to in the future.
Yeah.
Thank you so much first for doing this study and for submitting it to our journal. And thank you for being with us today to give us this interview. We really appreciate it. For those who are interested in reading the full article, they can find it on our journal website. Thank you again, Dr. Srivastava.
Thank you very much for having me, Khalid. Thank you.